Season 3 of the Love, Health, Prosperity podcast. And again, we have topics that are extremely interesting and that open up our curiosity, our mind to the things that are happening around us when it comes to mental health, when it comes to affecting the family, when it comes to embracing individuality. I think that's the most important thing. Today's subject is going to be a bit difficult to kind of unravel because it is a mental health disorder or mental disorder rather, that can be a little complicated to understand. The reason for this is because in my life, I've had the opportunity to work with a few people that have suffered from this, and it's been quite challenging in many ways. And the reason why I say it is because there's a lot of factors that sometimes get you to really grow concern for the person that you're caring for. Can you imagine all of a sudden you have this person that you're working with and they're having different thoughts. They're having conflicts within themselves. Sometimes they're losing touch with reality. Sometimes there's things called audio and visual hallucinations. Sometimes it could be homicidal or suicidal ideations. Sometimes it could be mixed wording, word salad, as they say. So today's topic is going to be, I invite you to really listen carefully because it's going to be quite educational. And for that today, our topic is schizophrenia. And our guest today is Karla Salamanca. She is a licensed professional counselor, and she's here to give us the insights, the basics. We're here to learn. Welcome, Karla. How are you today?
Hi, Marcelo. Thanks for having me. I'm doing great. Thanks so much. How are you doing?
I'm doing good. Thank you. I'm so excited to have you here today. Yeah. And as you could see, yes, this topic is very interesting. I like it. It's near and dear to both of us because I know for a fact that you have so much knowledge acquired in this particular topic, and I know you have a passion for it.
Yes.
But I'd like to delve into that a little bit with you. How did that passion come to be for you?
Well, after I graduated from my master's degree in rehabilitation counseling, I went to a fellowship program in San Diego with UC San Diego, and it lasted about a year. And we help people with schizophrenia, bipolar disorder, serious mental illness.
Mm-hmm.
And it was an interprofessional team. It was a fellowship. My role there was a vocational rehabilitation counselor. And they had psychologists, they had psychiatrists, they had social workers. So we were a small interprofessional team that helped those type of veterans that had those type of special needs. So it was a great to participate there, and we learn a lot about this type of population, and we help treat them each one in their own role. And then we would meet up as a group once a week or twice a week, and we would discuss these cases, so to help to treat the patient better.
So what is it? What is this schizophrenia?
Schizophrenia is a neuropsychological disorder that comes with symptoms that are mainly hallucinations, which is perceptual disturbances that come in any sensory modality. It can be visual hallucinations, seeing things that don't exist, auditory hallucinations, hearing voices, hearing sounds that don't exist, sensory experiences. Sometimes they'll feel like ants are like crawling in their skin.
Mm-hmm.
Things like that. And it comes also with delusions. Delusions pretty much are fixed thoughts
Mm-hmm.
that the person believes they are true, but when you present the reality, they still believe they're true.
Uh-huh.
So they continue to have those fixed thoughts that they can be persecutory in nature. They can feel or sense that somebody is like behind them, trying to do something bad to them. Sometimes they'll feel like the government is after them.
Like
things like
somebody's
that.
after them.
Exactly, things like that. And there's also other symptoms besides delusions and hallucinations. And I'm getting this from the DSM-5. Disorganized thinking is typically inferred from the individual's speech. Um, Grossly disorganized or abnormal motor behavior, which may manifest in several ways, ranging from childlike silliness to unpredictable agitation. Problems may be noted in any form of goal-directed behavior, leading to difficulties in performing activity of daily living. Catatonic behavior, which is a marked decrease in reactivity to the environment. This ranges from resistance.
Yeah, that word right there, Karla, catatonic.
Yes.
Already.
Yeah.
So, in your experience, how does that show up as a symptom? And so,
Well, they can be like very stiff, in their body, or they can have silly movements, and they become like frozen sometimes, or they become like very, very physically agitated.
okay.
So it ranges depending on the person. Schizophrenia, they're not the same symptoms for every single person. There's different symptoms for every single person. That's why it's so hard to treat.
So it's similar to, like, for example, an anxiety or depression. You get 10 people with the same diagnosis, but you treat them differently.
Exactly. Exactly. That's how it is.
So what are some of the things that, how does a person like begin to see some of those symptoms come to be when you're a mental health professional and you're starting to get to know a client? When you were doing your case studies in school, what were some of the things that you were looking out for?
Well, definitely odd behavior, delusional thinking. I would definitely ask them, first, like, are you feeling? Is there anything abnormal happening? Is there anything out of the ordinary that's happening? Something that's worrying you very much? Tell me about those experiences. And then after that, you would start like hearing about those symptoms slowly, because some of them, they don't want to share them because they're scared. They're truly scared of somebody following them. And sometimes they just seclude themselves, they isolate. So that's another thing that you look for, isolation, seclusion. Sometimes they recur to avoiding personal hygiene. Sometimes it comes with symptoms of depression as well. The prodromal phase is the first phase of schizophrenia, and it comes with symptoms of depression. And then the acute phase, that's when hallucinations and delusions and the motor symptoms and the speech problems come in. But sometimes, psychiatrists are trained to look out for symptoms that are similar to depression, because they're usually the same phase as the prodromal phase in schizophrenia.
Okay. So how do you link those things? When you start interviewing someone and you start kind of, getting a good feeling for what this person is going through, you notice that depression is one of the big ones. What kind of things do they talk to you about once you have built that rapport with them and they feel the confidence in, hey, Karla can understand me. I feel that, whatever I tell her, she's going to go ahead and she's going to make me feel comfortable so that I can disclose a little better. What are some of your methodologies for kind of taking this approach?
Well, we definitely have some tools, some evidence-based tools that once you have them in your hands, you ask the questionnaire. There's several for schizophrenia. And then you rule it out. You rule out schizophrenia versus psychotic disorder versus schizotypal disease versus personality disorder. You go by the DSM-5, and there's different evidence-based questionnaires that clinicians apply. So you usually have a sense of what's going on, but you always need the evidence-based tools to confirm what's going on.
For the people that are listening right now, and the people that are living with people who are diagnosed with schizophrenia, how come it's so difficult sometimes to reach out for help? So why is it so difficult to be able to say, okay, this is where we can actually, let's take this opportunity to go to a clinic or to go to the hospital to have this checked out. Why do you think it's so stigmatized right now?
Well, a lot of times, this comes to my mind first. A lot of times, people with schizophrenia have this, what's it called, lack of insight. Sometimes they don't realize that what they're seeing, thinking, feeling, it's real.
Yeah.
It's real for them,
You
but
think-
it's not real for others. It's not real in the real world.
So you think people have a hard time really believing what they're saying? Is that one of the things?
It could be, but it's mostly that the person doesn't want to accept that they have an illness, and they don't want to seek help because they think that what's happening, it's real. So to get them to acquire insight, that's a whole another thing that can be targeted during therapy. In CBT for psychosis, they can target all the positive symptoms, which is the delusions, the hallucinations, but they can also target the lack of insight if that's a goal of the treatment plan.
And when someone is diagnosed, do they have to be a certain age or anything like that?
No, usually schizophrenia occurs in teenagers, for the males, and during the teenage years, and for females occurs a little bit later. But it can be the case that schizophrenia appears after somebody goes to war and returns, and they had it in their genetics. They had a family member with the same disease, and it appears suddenly later in a later age.
So it's kind of like comorbid then with like post-traumatic stress disorder sometimes.
It could be. I've seen it occur after trauma.
Okay. After trauma.
After trauma in the adulthood.
And that's in the adult phase, like with teenagers. Now that you've mentioned teenagers, because I know they're so complex, right? Now we're opening up a different realm, right? With family and parents and maybe mom and dad being concerned. What are some of the things that you typically see when a mom or a dad or a family member come up to you and say, look, I think he or she needs help because this is what I see in them.
Right.
Does that make sense?
Yes. So sometimes the adolescents come with, symptoms, and they have like trauma, that happened in their early ages, and they come to you and they tell you, I have this best friend that it's an imaginary friend, and she tells me to throw the hot soup to my sister. She tells me to hit my grandmother. She tells me to do bad things, but I don't listen to her. But she's always there all the time. And
A commanding voice type of thing.
commanding voices, exactly. And do you see her? Yes, I see her,
And they can actually describe the person that they're seeing?
sometimes.
Yeah.
Yeah, sometimes. That's an example. But they see it as a part of their reality, And the parents, of course, concerned. Sometimes they do seek treatment for those adolescents. If the adolescent opens up, to their parents and says, this is what's going on. Sometimes they see it as a part of their reality, and they internalize it, and they just live with it. That's part of the lack of insight.
And that's a tough thing to do, because as a parent, what kind of things can you do to kind of assess those concerning behaviors, for example? I know sometimes being a teenager and being able to disclose and open up to your parents is just tough as it is. Just being a regular teenager, can you imagine all of a sudden saying, okay, well, I feel like somebody's always watching me, or I feel that, maybe on the computer, that little camera that's up there is looking at me 24/7 and is not letting me get the rest that I need. Or I feel that somebody's outside of my window kind of looking at me all the time. So how do you educate a parent on these type of things in your experience, Karla?
Exactly. The family is very important. It's a part of the treatment. Family education is part of the treatment. Definitely, once it has been identified, the disorder has been identified. You have to educate the family. What is schizophrenia? What are the symptoms that it entails? What are the positive symptoms? What are the negative symptoms? And they have to know how to help the patient and medication adherence. They
Hmm.
have to learn how to help the patient with how to survive in the community, how to survive in the classroom. You know,
Hmm.
there are many treatments for schizophrenia that can target all these issues, the symptomatically, problems, the symptoms, and the psychosocial issues that they experience. Because if somebody is scared, about somebody following them, they might act like scared in the classroom,
Hmm.
in with their peers, with the teachers there. They might act scared, or they may get scared at some point in time. So there's always family psychoeducation is incredibly important, and how to act also during emergencies, what to do during a crisis. um, plenty of things that have to be thought to the family in order to support the patient.
What does a crisis look like with a person living with schizophrenia?
Well, I personally never seen one, uh, but definitely somebody who is, not in touch with reality, that may be thinking about suicidal ideations or homicidal ideations. That will be a crisis.
Hmm.
Um,
Have you had to manage something like that?
no, no,
Okay.
not as of yet.
Hmm.
Um, but I think that will be a crisis, and the person has to be taken immediately to the ER to get evaluated, or to a psychiatric hospital.
That is no joke.
Exactly.
That's something that needs to get done like right away. And I'm so happy that you brought up the commands and some of the things that happen with it, because sometimes we try to deny that something is wrong. Sometimes we don't want to look at the reality of things. And when somebody is sharing symptomologies that are sometimes related to what we're talking about right now, it's a bit scary if you think about it. And
Exactly.
and for them to think that the people that are trying to help them sometimes are sometimes enemies, right? You're against me, you're not helping me, I think you're a part of the problem, then that could be quite difficult also. But I'm so happy at the fact that you brought up that homicidal and suicidal ideations are something that can be a presentation of schizophrenia sometimes.
Exactly.
What about addictions? Is that something big also? Would you say drugs and alcohol also play a role in all this?
Well, there is comorbidity with substance use disorder, definitely, because individuals sometimes don't know how to cope with the symptoms, and
Hmm.
they recur to alcohol and drugs
Hmm.
to alleviate their concerns, their fear, their symptoms
Hmm.
simply. And it's a big comorbidity. But also there are some substances that lead to hallucinations,
Hmm.
like cannabis.
Yeah,
um
I'm glad that you're covering that, and that's has been scientifically proven, correct?
yes,
Okay.
yes.
So how does that how does can you elaborate on that, please?
Yes, I mean, if a person is smoking cannabis, sometimes they'll experience hallucinations, as a side effect of the drug. And it gets worse when the person has the genes of schizophrenia. It can target schizophrenia as well.
It could trigger
It
it.
could trigger
Hmm.
schizophrenia as well. So, there's a lot of research about this, and people need to be careful. People just need to be careful about doing drugs and alcohol, because you never know what may happen to you.
Absolutely. Yeah, it could
Mm-hmm.
definitely take a toll on anyone.
Mm-hmm.
So if somebody goes to a clinic and they get a diagnosis, say a parent gets a diagnosis that their child does have presentations of and symptomologies of schizophrenia, what then would they, what are they going to expect? What does the therapist do typically in the situation? How do they treat it?
Okay, there are many treatments. First of all, pharmacological treatment with antipsychotics. There's first generation antipsychotics like Haldol. Those antipsychotics are more than 50 years old, so they're in this era they're not no longer very much prescribed. People psychiatrists usually prescribe second generation antipsychotics like risperidol, Abilify, etc., because they don't have extra what they call extrapyramidal side effects, which is symptoms that come as a secondary, after taking the medication, like a side effect like tremors. Sometimes they come with lactation, a lot of weight gain, that leads to metabolic issues. So those first generation antipsychotics are typically not prescribed. It's usually the second generation, the more modern type of therapy. Also, aside from medication treatment, there's a lot of psychosocial treatments.
Well, see, that's the thing. There's a lot of parents, right, that are skeptical about medication. Maybe they don't want to go that route. I think it's most likely, depending on the situation, a necessary route to take. But what other methodologies? And I know you're about to jump into that right now.
Yeah, there's always therapy. There's two types of therapy that help with schizophrenia-like symptoms. Cognitive behavioral therapy for psychosis, and there's also recovery-oriented cognitive therapy. This is a new model that was just recently released, like maybe about 8 years ago. Recently I brought a manual to show it to therapists at the end of the segment. So they can buy it and help with the therapy. There's also cognitive remediation. This is for children and adults. Cognitive remediation helps with executive function, with memory, memory retention, all that type of stuff. There's also for adults, there's like supported employment. Pretty much you will have that's what I did in San Diego. As a vocational rehabilitation counselor, you help the patient, the client, to obtain a competitive job. It cannot be just any job. It has to be a competitive job.
Okay, so not like, all right, your average job. You can get something that, all right, you studied, you went to university, you did everything. Okay.
Exactly. It can be a competitive job according to their knowledge, skills, and abilities, that pays well, that pays over the minimum wage. And there's also family psychotherapy, and family interventions, like I said, for crisis, for education about symptomatology. There's also social skills training. I'm sorry about that.
It's okay.
Social skills training. Pretty much what they do is they help the individual behave in social settings, how to behave in a group, in a group, when you're within a group of people, how to talk to somebody without being scared, how to maintain a conversation with somebody without feeling that the person behind that person is threatening you, how to manage the symptoms in a social setting. There's plenty of programs. For example, here in El Paso, Emergence Health Network has the intensive outpatient program. They also educate the clients about mental health symptoms and how to cope with their symptoms and with their social lives. But pretty much the psychosocial treatment targets things that are not targeted with medication. Everything that's not targeted with medication is targeted with psychosocial training. And pretty much this psychosocial training will help the person live a better life, accomplish goals, have a partner, have a job they like, have hope about their future, live a life like anybody else. And it definitely can be accomplished. And we have several examples. We've been reading a book about Ellen Sachs, who is a professor of law and psychiatry at USC. And she wrote a book, a memoir about her symptomatology, how she lived with everything. And she still was able to accomplish her 3 degrees, 2 in the United States and 1 in the UK. And there's a lot of literature on professionals that live with schizophrenia and that are, with the proper supports, of course, and with medication, are able to have a very full life with joy and optimism and all those things.
Yeah, I love that you mentioned that, and I love that you mentioned the book because you told me to read it. So it's The Center Cannot Hold, written by Ellen Sachs right here. And what I liked the most about it that you had talked about was, she went to university. She went to the UK. She attended Oxford University. She graduated. Now she's a professor at the University of Southern California. This is a very good book because she talks about pretty much from how it started to how it's kind of going for her, because sometimes we think that such a difficult diagnosis is going to lead us in a path that sometimes could be too uncertain to know what the future could look like. But she kind of walks us through the whole thing. She tells us how it all began with her symptomology, and that her parents were extremely supportive. And sometimes the best part, I think, was what you had just mentioned right now, all the help that's available for people with a diagnosis. And I think that's golden right there, because I couldn't imagine 30, 40 years ago, well, even more, when people didn't really know what to do or where to go or where to access resources. And she talks about it in this book that one of the things that happened to her a lot of times was when she was institutional or hospitalized, that she was being tied up, restrained.
Exactly.
Yeah, and that affected her so much. So she talks about that also. And for the people that are listening right now, it's an awesome book. And Karla recommended it to me, The Center Cannot Hold, written by Ellen Sachs. Check it out if you have a chance. Believe it or not, we're running out of time already.
Awesome.
Yeah, that was good.
That was
I know
great.
you bought some stuff that you wanted to kind of share with.
Yeah. So I just wanted to read a quick excerpt of a Schizophrenia Bulletin Journal. And this article was written by Ellen Sachs and other professionals who actually have schizophrenia diagnosis. And pretty much she said that so it says the fact that these professionals have publicly identified themselves as having been diagnosed in treatment for schizophrenia, but have nevertheless obtained doctorates and are performing as professionals in the mental health field, and of itself sends a strong message. By being open about their psychiatric conditions, they are implicitly demonstrating that the diagnosis of schizophrenia no longer means that we will necessarily experience the lifetime cataclysmic consequences once assumed that accompany the disorder. Without necessarily being explicit about the issue, these professionals are establishing a significant functional measure of recovery, and clearly the greater number of persons, especially those in mental health professions, who are willing to be open and even public about the conditions, the more normalized schizophrenia becomes.
Yes.
So I think that's pretty impactful because there's hope. There's hope out there. You just gotta get on it. If you're listening to this and you have schizophrenia, get on it. Look for help. There is help in the community.
Great. Thank you so much for that. Now, before we end, how do people find you, and second question, words of encouragement regarding the topic for families in our border city?
Definitely. So families can always find support two things come to mind. NAMI El Paso. They can Google NAMI El Paso. They have support groups for family who have members of the family with schizophrenia or any other mental illness. You can join through Zoom. It's free. And they also have Emergence Health Network here in El Paso, which is the health authority in El Paso, the biggest change of mental health clinics in El Paso. And they have a lot of support there too, a lot of programs, and they can definitely get help through there. I also recommend for therapists the recovery-oriented cognitive therapy by Aaron Beck and other colleagues. This helps treat schizophrenia and bipolar disorders and serious mental illness. So definitely something to think about. And just look for help. Look for help. Help's out there, and don't give up, because life has a meaning, and you can accomplish a meaning in life through help of your family and professionals.
Thank you so much for that. We have linked all your information, your socials, onto the podcast. We want to thank you once again for being with us today and sharing your knowledge on this topic. Quite interesting, very enlightening, and I think very necessary for the people that are listening to our podcast right now. So I want to thank you for being on our show.
Thank you for inviting me, Marcelo. It was fun.
Awesome. And thank you guys for watching another episode of the Love, Health, Prosperity podcast, where we try to bring you as much information that is going to benefit our border city.